Hi there. Welcome to the 2020 GRBS Human Resources Refresher. My name's Ben Hall, and I'm the Director of Human Resources here at GRBS. I want to start by taking a moment to thank all of our team members. Thank you all for working through these challenges that we've had with COVID-19. Thank you to those that have continued to work through the school year. Thank you to those that have had to go on temporary leave with reduction in work to come back as work has once again become present within school buildings. It's been a challenge. We have had to all make adjustments as these changes have been presented to us from guidelines from the state of Michigan, from expectations from our customers and how they're moving forward with education of their students. It's been a challenge to navigate, and it required a lot of patience. We hopefully helped keep everyone up to date through the process of our urgent messages back in March, when there were changes that were happening so frequently and on a day-to-day basis, with some school districts closing temporarily to open later with different staffing levels, maybe going to a reduced staff to come back to a full staff, and vice versa. Really unprecedented time as we've moved through this together to make sure ultimately that we're taking care of our customers and that we're taking care of our team members to the best of our ability, and that we're staying safe. And that's really why the refresher today is so important. We will be talking a lot about the changes from COVID-19, the updates that are needed to make sure that we are continuing to stay safe, and that we are staying safe not only for ourselves, but for the team members that are surrounding us, for our customers, for teachers, for students, for community members. All really important as we move forward and be as successful as possible together. Not only are we going to be talking about COVID-19, but there's other pieces of the refresher that will be going into GRBS policies, GRBS procedures, some GRBS program updates, as we typically would during refresher. This is a different format for us. With COVID-19, we've been challenged to adapt to the use of technology. Many of our meeting formats have gone to the use of virtual platforms like Zoom. We are taking that even a step further with refresher, where we're looking at doing today the recorded version, right? And a lot of that comes from the impact from how many are allowed to gather indoors for training sessions and functions that we would typically all be together for. So while this is a different format, I believe that it is important information you are going to find valuable and help continue to educate not only on our policies or in process, but also some education on coronavirus to help allow you to feel better about what the virus is, how it's transmitted, and how to protect yourself. So with that, let's go ahead and get into the COVID-19 update. So these are some things I'm going to be touching on today as we go through the refresher course. So COVID-19, as I said earlier, has caused many changes and will continue to do so. So one of those changes that has been present is our new PPE requirements that are requirements from the state of Michigan based on guidelines from the CDC, so that we can work in schools and be safe and keep others safe. There's continuing requirements on social distancing that we've had in place and we're going to continue to have in place moving forward. There's limits on indoor and outdoor gatherings, again, which is part of the reason we're doing this in a different format this year. There's an increased focus on health screening. Health screening has been present in our accounts again, really since March, it comes in different formats, and we'll talk about what that health screening looks like and how your individual district may be doing some of that health screening. There's different requirements for cleaning, right? With COVID-19, the increased focus on disinfection and the frequency in which we do disinfection. The way buildings are used, right? Building usage when it comes to schools. How are students eating lunch? Where are they going to be? Classroom, cafeteria. How many gatherings is the school district going to have, and how are they getting their students into classrooms and in between classes, and all these components that are important to navigate that ultimately affect us and how we clean. So there's going to be some additional videos that come about that drill down into your individual school district and in the requirements for the account that you're working in and how they're operating. The goal today is to talk really company-wide about COVID-19, specifically towards the beginning of a refresher, and how we're all impacted in the processes that we all have to follow here moving forward. So let's get started with the PPE requirements. So part of the return to school roadmap that the governor put out in June, mid-June, issued some new requirements on PPE. New requirements include a surgical face mask. These are the disposable face masks. You can see a picture there on your screen. Face shields and gloves. So our mission is to provide PPE kits for every team member in the field. These PPE kits are going to include those three items. Let me tell you a little bit about how this is going to work. So shortly, there's going to be a PPE distribution day that's taking place within your account. On that day, you're going to go, there'll be a meeting area that's outside, and it'll be staggered for social distancing and limited gathering. But you're going to get a PPE kit that has 5 masks, a face shield, and gloves. Individual gloves that are in your size that you are going to keep. The face mask, there will be 5 of those in the PPE kit. The concept is that you will have one for each day of the week. Each week on Friday, you'll get a new PPE kit with, the 5 new face masks for the following week. We're providing those at the end of the week so that you always have a face mask where you can arrive to work with your face mask on as you're going into the buildings. You cannot be in a building without a face mask. This means you can't walk in and then put the face mask on. You have to walk in to the building ready to go with the face mask already on. Face shields. The face shield we're providing not longer. Our expectation is that if they're taken care of, that they will last. If you should have a face shield that becomes damaged, it's unusable, and it needs to be replaced, you need to let us know so that we can get you a new face shield. And then gloves. Again, you'll get gloves that are in your size that you are to wear during all cleaning activities. These gloves are reusable. The expectation is that they should last a month. But if you start to wear out the gloves, they become damaged, they're unusable, we will get you a new pair. But the expectation is they should last roughly a month. There are some processes on making sure that they stay cleaned. You wash the reusable gloves like you would your own hands, and following those same guidelines with washing your hands for 20 seconds. Rule of thumb is singing the ABCs or singing happy birthday to give you a concept of total time that's passed. But you want to wash those and then make sure that they're being taken off properly and put back on properly when you're ready to use them again. There's going to be a video that we're playing here next that's going to talk about how to safely remove and then again put on those gloves to make sure that everybody's doing that properly. With the PPE requirements, the important piece is that this is designed to keep everyone safe. And all three of these items should be worn while performing cleaning duties. You can take the mask off when you're sitting down at break, eating, drinking. That's the only time the mask can be removed. Otherwise, it should be on when you're indoors. These pieces of PPE are now part of your uniform, as critical as the uniform. The uniform expectation has always been the GRBS polo shirt, khaki pants, and ankle supporting boots, and of course your ID badge. The PPE, including the face mask, face shield, and gloves, are now a part of that. And leadership will be making sure that we are in compliance with being in full uniform so that, again, we're doing everything that we're supposed to in accordance with the state requirements and in accordance with the CDC and in accordance with our school districts and our customers. Again, with the ultimate goal of keeping everyone safe and minimizing the spread of COVID-19. So next up will be the video that we're going to watch on gloves. And then we are going to talk a little bit more about social distancing. Social distancing is a critical component to helping prevent the spread of coronavirus. All team members must practice safe social distancing. This has been something that we have been talking about since March, when we first did our coronavirus preparedness and response plan. Social distancing from CDC guidelines is 6 feet is the expectation to stay away from someone else. We know that coronavirus spreads mostly from person-to-person contact and being within that 6-foot space, and it spreads from droplets in the air. Our expectation is that we're able to continue to maintain 10 feet of social distancing. We believe because of the work that we do, we never have to be closer than 10 feet. We can communicate from 10 feet away. We can train from 10 feet away. We're doing individualized tasks that do not require someone else to be right next to us. This is how we are able to help continue to stay safe. And when you think about the type of work we do, minimize contact with people. And we believe it's some of the safest work that's available because of the ability to social distance. With that, we do need to be aware of our surroundings. Who else is in our presence? And if they're not social distancing, that we're taking ownership of the social distancing and making sure that we're in control of ourselves and maintaining that distance and giving cues to whoever might be around us for the distancing requirement. If everyone takes responsibility for themselves, we should all be successful in making sure that we're staying safe and socially distant from each other. One of the challenges with social distancing does become small spaces, custodial offices and break rooms. especially as you are taking lunch, making sure that you're still staying socially distant and spread apart at lunch tables, and you're not breaking with large groups of team members in one space, so that we are staying spread out and effectively maintaining that social distance. Another requirement with COVID-19 is health screening. Health screening has been present within many of our accounts, and in fact, company-wide, we've had a health screening tool on our automated time and attendance, or ATA line. There's a reminder that runs through common symptoms of COVID-19 and asking if you have any of those symptoms to stay home and do not report to work. Some districts have a Google screening document that's required to be filled out prior to going into work. If your school district, your account is one that requires that Google screening document, it is important to make sure that that's being done. And it is a requirement to be done. It's something that we will hold accountable, and you will not be able to report to work unless that's being filled out. Again, overall goal is safety first and foremost for all of our team members. Some districts do temp checks. So while the expectation is that we're all monitoring our own health and understanding if we might have a fever through chills or things like that that are indicators, there's some districts where there is a screening point where you enter the building, and even in our own GRBS office spaces now in Grand Rapids, Portage, Birmingham, and Plymouth Canton, we have screening where there is a required temp check. When we think about symptoms of COVID-19, I want to go over some common symptoms that are indicators that COVID-19 could be a concern. So when we talk about temperature screening, first and foremost, 100.4 degrees or higher is considered a fever, and that would be a concern, and you should not report to work. Also, dry cough, sore throat, shortness of breath, or difficulty breathing are all symptoms, common symptoms associated with COVID-19. So the question becomes, what do you do if you do have symptoms of COVID? First off, you need to stay home. You cannot report to work, and you have to call the office. And furthermore, reporting symptoms of COVID-19 to Human Resources so that we understand what's going on. And that way we can direct further and give you information on potential testing. Do you need to talk to your doctor? What's the quarantine process? How long do you have to stay away from work? These are all important pieces that Human Resources can help navigate. Every situation is going to be a little different, so that's why we're here, to help with those questions and to make sure that everybody's staying safe and healthy. If someone in your household or yourself has a confirmed case of COVID-19, you have to report this to Human Resources immediately as well. The baseline quarantine for a confirmed case of COVID-19 is a minimum of 14 days. It could be longer depending on the situation, and Human Resources can help with that. Also, your doctor, as you work with your healthcare professional to determine next steps regarding a confirmed case of COVID-19. But very important, bottom line, stay in contact with Human Resources for any type of symptoms, and certainly a confirmed case, so that we can take appropriate next steps. One of the common questions that I've received, I would say within the last probably month, has been, what happens if there is a COVID-19 exposure concern? You as an employee have potentially been exposed to COVID-19, but you're not sure. So let's drill down a little bit and provide some guidelines. My hope is to educate everyone so that you understand really what an exposure situation looks like. Remember, one of the things that we talked about already is COVID-19 is most likely transmitted from person-to-person contact with being in a close proximity of each other within 6 feet. So when we talk about confirmed cases and exposure, you have to meet that threshold. So not only 6 feet, but for a period of 15 minutes or longer. So not only are you within that window, but it's for an extended period of time, which is really important to understand. One of the other pieces of this is a scenario that I've heard. My brother was possibly exposed to a case of COVID-19 from his job, and then I've been around my brother. To qualify as exposure, again, it's you yourself as an individual has to be in close contact with a confirmed case. So that chain of contact isn't something that we are concerned with. It doesn't work that way. Close contact from the CDC is within 6 feet for a period of 15 minutes or more. Hopefully that provides some explanation and some guidance. As always, you'll hear me say this throughout the presentation today. Call Human Resources if you have questions. My goal is just to give you as much information as possible so that you feel as comfortable as possible when we talk about COVID-19 and what possible exposure elements are there. The key point to this when we talk about exposure is if you are in the same building with somebody who has a confirmed case of COVID-19, this doesn't necessarily mean you were exposed, because again, that period of 15 minutes within that 6 foot distance is what is considered the close contact aspect of exposure. So you could be walking down a hallway and somebody has COVID-19. If you are within a 6 foot distance and it's for a very short period of time, such as walking past somebody, that would not meet the threshold of qualifying as exposure. So again, hopefully this helps provide some guidance and some insight into what that really means. I know there's a lot of nervousness. There's a lot of apprehension when it comes to COVID-19 and everybody wanting to stay safe and healthy. So if we can provide information that helps you understand what that means when it comes to exposure, hopefully that's helpful. So one of the common pieces of a refresher is safe schools. Typically during our fall refreshers, we will do safe school videos on asbestos, bloodborne pathogens, and restraint and seclusion. We are playing these videos at our winter refresher is the anticipation this year. Saving time for our courses, new courses through Safe School on coronavirus, because it is the most urgent topic, the most pressing topic that we have to make sure that we are doing our part and providing the education for, so that we can get back to work here in the fall in school districts and all be as educated as possible on coronavirus. So the next video is one on general awareness presented through Safe Schools regarding what coronavirus is, how it spreads, and ways to protect yourself and others. As always, through any of this presentation, if you have questions, make sure that you're reaching out to me at the end of the presentation today. I'm going to go ahead and make sure that my email address is listed. You can call me at the office or email. Because we're doing this in a different format and we don't have the ability to interact and have a back and forth with questions, I will make sure that I'm answering those questions as they come in to get answers back to you to help with any clarification that you might need.
The current coronavirus outbreak has dominated the news cycle since late 2019. The outbreak involves a new type of contagious virus for which there is, as of yet, no vaccine. The new virus has been named SARS-CoV-2, and the disease it causes is called COVID-19, which stands for Coronavirus Disease 2019. Like many others, you may be concerned about this new virus outbreak and its possible effects on public health, globally, locally, and personally. This course is designed to give a brief overview of the rise and spread of COVID-19. We will describe the symptoms and risk factors, discuss what you can do to help reduce your chances of becoming infected, and identify where to find reliable, up-to-the-minute news and information about the COVID-19 outbreak. At the end of the course, you'll have a chance to test what you've learned with a short quiz. So, if you're ready, let's begin. Coronaviruses are a large and common family of viruses that can occur in animals and in humans. Most of us get infected with coronaviruses at some time in our lives. They usually cause mild to moderate upper respiratory infections, resulting in symptoms much like those of the common cold, but they can also cause more severe illnesses, such as bronchitis or pneumonia. In addition to the more common coronaviruses that affect humans, sometimes a new variety of coronavirus can develop in animals and then cross over to humans. Past examples of this include the coronaviruses that cause SARS, the Severe Acute Respiratory Syndrome of 2003, and MERS, a Middle East Respiratory Syndrome first reported in 2012. The most recent coronavirus of this kind, SARS-CoV-2, was discovered in Wuhan, China in December 2019. And as we mentioned earlier, this is the virus that causes COVID-19. COVID-19 spreads from person to person like other respiratory viruses, through small droplets of saliva or mucus, which can be expelled when coughing, sneezing, or just exhaling. These droplets land on nearby objects and surfaces. If another person comes into contact with the expelled droplets and then touches their own eyes, nose, or mouth, they can become infected with the virus. The droplets can also be passed during close personal contact, as when touching or shaking hands with someone. And if you're close enough to a person with COVID-19, within about 3 feet, you could also breathe in droplets that the person exhales or coughs out. Symptoms of COVID-19, which usually show up between 2 and 14 days after infection, can range from mild to severe. Typical symptoms include fever, tiredness, and dry cough. Some patients also report achiness, congestion, runny nose, sore throat, and diarrhea. Symptoms are usually mild and begin gradually. It's also possible for people to be infected with COVID-19 without developing symptoms or feeling unwell. Most people who contract COVID-19 recover without the need for special treatment. A small percentage of people with COVID-19 become seriously ill and can develop difficulty breathing. An even smaller percentage die from the disease. While everyone is assumed to be susceptible to contracting COVID-19 if they're exposed to the virus, the World Health Organization, or WHO, reports that those at greatest risk for developing a severe or lethal case of the disease are those over 60 years old, and those with underlying conditions such as hypertension, diabetes, cardiovascular disease, chronic respiratory disease, and cancer. Among children, the disease appears to be relatively rare and mild. The response to the outbreak of COVID-19 has included efforts to isolate affected groups and contain the spread of the disease, as well as extensive study and research focused on understanding this new virus and developing medical therapies or vaccines to combat it. The WHO recommends these strategies to help lower your risk of contracting COVID-19. Clean your hands regularly with an alcohol-based sanitizer or wash them thoroughly with soap and water. This will help reduce your risk of transferring the virus from contaminated surfaces or sick people to your own eyes, nose, or mouth. Regularly clean surfaces, such as kitchen tables, chairs, countertops, and work surfaces with disinfectant. Learn about COVID-19 from reliable sources, including your local or national public health agencies, the WHO website, or your own healthcare provider. Know the symptoms. It usually begins with a fever and a dry cough, not a runny nose. Most people will have mild symptoms and get better without needing any special care. Avoid traveling if you have a fever or cough. If you become sick during a flight, inform the crew. Once you get home, contact a health professional and tell them about where you've been. Cough or sneeze into your sleeve or use a tissue. Dispose of the tissue immediately into a closed trash can and then wash your hands. If you're over 60, or if you have an underlying condition, such as cardiovascular disease or diabetes, you have a higher risk of developing severe disease. You may wish to avoid crowded areas or places where you could interact with people who are sick. If you feel unwell, stay at home and call your doctor or local health professional to discuss your symptoms, where you have been, and whom you've been in contact with. If you're sick, stay at home and eat and sleep separately from your family. Use different utensils to eat. If you develop shortness of breath, call your doctor and seek care immediately. It's normal and understandable to feel anxious, especially if you live in a state or community that has been affected by the COVID-19 virus. Learn what you can do in your community. Discuss how to stay safe with others in your workplace, school, or place of worship. To find comprehensive and authoritative news, updates, research, and recommendations concerning COVID-19, visit the websites for the WHO and the U.S. Centers for Disease Control and Prevention.
All right. Hopefully you found that beneficial. The next video that we're going to watch is on cleaning and disinfecting your workplace. So this next video is on the process of cleaning and disinfection of areas in which there's been a confirmed case of COVID-19. This isn't generalized cleaning. This is cleaning up after a confirmed case. Again, a general awareness course talking about general practices. With that, there are specific practices GRBS follows, specific processes GRBS follows that should always take precedent, and always make sure you understand those processes set forth by your supervisor, by your manager, throughout other training that you're going to go through here during the refresher process as you enjoy some of the operations presentations. GRBS uses CDC approved and EPA registered disinfectants for COVID-19. So we do not use bleach. You're going to hear bleach referenced throughout this video. Please ignore those references. This is not something GRBS does.
Protecting you and your workplace against the coronavirus, also known as COVID-19, starts with getting the right information. The intent of this course is to provide you with practical guidance from the Centers for Disease Control and Prevention, CDC, for cleaning and disinfecting rooms or areas where those with confirmed COVID-19 have visited. There is much to learn about COVID-19. Based on what is currently known about the virus, spread from person to person happens most frequently among close contacts within about 6 feet. This type of transmission occurs via respiratory droplets. Transmission of the coronavirus to persons from surfaces contaminated with the virus has not been documented at the time this course was published. However, current evidence suggests that the coronavirus may remain viable for hours to days on surfaces made from a variety of materials. Transmission of coronavirus in general occurs much more commonly through respiratory droplets than through objects or materials which are likely to carry infection, such as clothes, utensils, and furniture. Cleaning of visibly dirty surfaces followed by disinfection is a best practice measure for prevention of COVID-19 and other viral respiratory illnesses in community settings. These guidelines are focused on community, non-healthcare facilities such as businesses, offices, schools, institutions of higher education, daycare centers, and community centers that do not house persons overnight. These guidelines are not meant for households or cleaning staff in healthcare facilities or repatriation sites, or for others where specific guidance already exists. Any supporting documents referenced throughout this course can be found in the resources section of this course. By the end of this course, you will be able to identify the differences between cleaning and disinfection, identify best practices for cleaning and disinfecting, Identify PPE and hand hygiene best practices. Community facilities, such as businesses, schools, and daycare centers, comprise most non-healthcare settings that are visited by the general public outside of a household. Cleaning refers to the removal of dirt and impurities, including germs, from surfaces. Cleaning alone does not kill germs, but by removing germs, it decreases their number and therefore any risk of spreading infection. Disinfecting works by using chemicals to kill germs on surfaces. This process does not necessarily clean dirty surfaces or remove germs, but killing germs remaining on a surface after cleaning further reduces any risk of spreading infection. It is recommended to close off areas used by ill persons and wait as long as practical before beginning cleaning and disinfection to minimize potential for exposure to respiratory droplets. Open outside doors and windows to increase air circulation in the area. If possible, wait up to 24 hours before beginning cleaning and disinfection. Cleaning staff should clean and disinfect all areas, such as offices, bathrooms, and common areas, used by the ill persons, focusing especially on frequently touched surfaces. If surfaces are dirty, they should be cleaned using a detergent or soap and water prior to disinfection. For disinfection, diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and most common EPA-registered household disinfectants should be effective. Diluted household bleach solutions can be used if appropriate for the surface. Follow the manufacturer's instructions for application and proper ventilation. Check to ensure the product is not past its expiration date. Never mix household bleach with ammonia or any other cleanser. Unexpired household bleach will be effective against coronaviruses when properly diluted. Bleach solutions can be prepared by mixing 5 tablespoons or 1/3 cup of bleach per gallon of water, or 4 teaspoons bleach per quart of water. Products with EPA-approved emerging viral pathogens are expected to be effective against COVID-19 based on data for harder-to-kill viruses. Follow the manufacturer's instructions for all cleaning and disinfection products, such as concentration, application method, and contact time, etc. For soft, porous surfaces, such as carpeted floor, rugs, and drapes, remove visible contamination if present and clean with the appropriate cleaners indicated for use on these surfaces. If the items can be laundered, launder items in accordance with the manufacturer's instructions using the warmest appropriate water setting for the items and then dry items completely. Dirty laundry that has been in contact with an ill person can be washed with other people's items. Do not shake dirty laundry. This minimizes the possibility of dispersing virus through the air. Remember to clean and disinfect hampers or other carts for transporting laundry. Cleaning staff should wear disposable gloves and gowns for all tasks in the cleaning process, including handling trash. Gloves and gowns should be compatible with the disinfectant products being used. Additional PPE might be required based on the cleaning, disinfectant products being used and whether there is a risk of splash. Gloves and gowns should be removed carefully to avoid contamination of the wearer and the surrounding area. Gloves should be removed after cleaning a room or area occupied by ill persons. Clean hands immediately after gloves are removed. Cleaning staff should immediately report breaches in PPE, such as tears in gloves, or any potential exposures to their supervisor. Cleaning staff and others should clean hands often, including immediately after removing gloves and after contact with an ill person by washing hands with soap and water for 20 seconds. If soap and water are not available and hands are not visibly dirty, an alcohol-based hand sanitizer that contains 60 to 95% alcohol may be used. However, if hands are visibly dirty, always wash hands with soap and water. Follow normal preventive actions while at work and home, including cleaning hands and avoiding touching eyes, nose, or mouth with unwashed hands. Additional key times to clean hands include after blowing one's nose, coughing or sneezing, after using the restroom, before eating or preparing food, after contact with animals or pets, before and after providing routine care for another person who needs assistance, such as a child. Employers should work with their local and state health departments to ensure appropriate local protocols and guidelines, such as updated additional guidance for cleaning and disinfection, are followed, including identification of new potential cases of COVID-19. Employers should educate staff and workers performing cleaning, laundry, and trash pickup activities to recognize the symptoms of COVID-19 and provide instructions on what to do if they develop symptoms within 14 days after their last possible exposure to the virus. At a minimum, any staff should immediately notify their supervisor and the local health department if they develop symptoms of COVID-19. The health department will provide guidance on what actions need to be taken. When working with your local health department, check their available hours. Employers should develop policies for worker protection and provide training to all cleaning staff on site prior to providing cleaning tasks. Training should include when to use PPE, what PPE is necessary, how to properly put it on, use, and take off PPE, and how to properly dispose of PPE. Employers must ensure workers are trained on the hazards of cleaning chemicals used in the workplace in accordance with OSHA's Hazard Communication Standard. Employers must comply with OSHA's standards on bloodborne pathogens, including proper disposal of regulated waste and PPE. The coronavirus should be taken seriously. By ensuring that you understand actions you should take to clean and disinfect locations of those with suspected or confirmed COVID-19 have visited, you are taking actions to keep you, your household, and your workplace safe.
All right. So that is the conclusion of our Safe School courses here for today. Again, the traditional Safe School courses, the intent is to play those as we move into the winter refresher in December. If you have any questions about either of those videos or anything in the presentation, you're going to hear me say it several times today. Please make sure that you're reaching out. The next item that I want to talk about is, as we move away from COVID-19, getting into some GRBS processes and policies and programs. We do have a new drug screen policy and process that's in place. As you know, GRBS conducts an annual drug screen to ensure all our employees are safe when working in schools. That said, the state of Michigan legalized recreational marijuana last year, so we've made some changes. We're no longer testing for marijuana during our pre-employment drug screens, but we still do have a zero tolerance policy for marijuana while at work. That means a couple things. If there is any suspicion that you're under the influence of marijuana, suspicion meaning physical indications or smell, you would be sent to a Concentra drug testing location or another comparable occupational health drug testing location, and your analysis would be conducted. As well, if you're hurt at work, part of our work comp program is there is always a post-accident drug test that's involved. Marijuana is included in that. In either of these instances, if you do fail the drug screen and test positive for marijuana, you will be terminated. There is an opportunity to be able to reapply in 30 days and have a clean drug test, in which case you would be eligible for rehire. But I can't stress the importance of this enough. While we're not doing pre-employment drug testing or the annual drug testing involving marijuana any longer, the zero tolerance policy is still very much in place. And any presence of marijuana and being under the influence of marijuana while at work will result in termination. Switching gears now, let's talk about the employee portal. So the employee portal has been an evolving communication tool for us over the last couple years. We have updated the portal within the last month to change the login process. We've also moved some things around on the portal and done some reorganization to make it more streamlined, to make it easier to find items. But really the biggest reason for the update on the portal was to change the way that we log in. One of the common issues that we would get from team members is being locked out of the portal account by not remembering username or password. So we've simplified that process. So the username is now your employee ID. across the board. And then your default password is your employee ID plus your birth year. Hopefully this makes it easier to be able to log in, remember your information so that you can get into the portal. This is my plug on the employee portal. It is extremely important to be on that portal and checking it weekly for updates. For those of you that have been with us, again, since the start of the coronavirus pandemic, going back to March, we issued a lot of communication on that portal. If you weren't on the portal, you were missing out on those urgent messages giving specific instruction for various school districts, for company information. So it is critical that you're on that portal for not only that really, really important information, but for things like newsletters, for other updates that are being pushed out to the company. With that said, we are excited to announce that there is going to be a GRBS phone app coming. We think this is really going to change the way people access the portal and make it even that much easier. We've been asked about this for years since we started the portal. Is there an app? And now we do, thanks to Lindsay Schricker, our technology guru here in the Human Resources Department. We do have the Android app ready to go, and we're just finalizing the Apple app for the iPhone. And then we will be launching this relatively soon. So be on the lookout. We're going to advertise this in the newsletters and on the portal itself on that main page where you can access information. So be looking out for those updates. All right, so switching gears again here, I want to talk about the GRBS employee benefits. So we have a couple different benefit programs that we launched last year, going into the new school year, into fall, that we were really excited about. And we continue to be excited about them, and we want to make sure that all team members have a knowledge of what those programs are and are using those and taking advantage of those programs. So there's two of them. There's the branch daily pay, as well as our employee discounts. So I want to go ahead and dig down into the branch daily pay option here first off. The branch daily pay app is a way that you can work hours for a day and then have access to be paid a portion of those hours out that same day. In other words, you have an emergency situation, a need for money right away, and you cannot wait till payday. By having an account through the branch daily pay app, then you're able to go ahead and either get the money out right away. There is a transaction fee if you are taking money out immediately, so make sure that you're taking out the money that you'll need. Or there is an option to go ahead and get that money within 24 to 48 hours during the regular speed of a bank account transaction process. There's no fee for that if you can wait that 24 to 48 hours. So there may be various reasons that you want to utilize this app from, again, maybe it's not all the time that you're looking to take out money right away, but because life threw you a curveball and maybe you need some additional car repairs or some other expense came up where you need money right away. There's also two other components of the branch app that really promoted us to go with this particular pay daily program. There is a budgeting component with the branch app. So if you sign up for branch, there's a ability to input your monthly expenses. So all your different monthly bills that you have, and then the branch will help you budget incoming money versus the outgoing bills that you have. And then the third piece of this is if it's looking and it sees that based on your money coming in versus your outgoing expenses that there might be a shortfall, there is the ability to turn around and be directed to a portion of branch that allows you to pick up additional shifts that are posted by GRBS through the operations team as well as human resources. I highly encourage everyone to be on the branch app. Even if you go, you know what, I don't need the daily pay feature on it, that ability to pick up branch additional shifts is great. So maybe you're looking to go, you know what, I'd like some extra hours this week, to be able to look on that branch app to see what options there might be available within your account or available within the surrounding accounts that are close by is a really useful tool to be able to have access to those additional shifts and possibly get overtime or additional bonuses for helping us to cover some temporarily open positions or maybe some extra work that's available. All right, so next program is that employee discount program that we just talked about. So the employee discount program is something that we fully launched last fall. We've had pieces of this that have been in play for quite some time. We've had a discount program through RX Optical. You don't have to have our vision insurance, by the way, to utilize it. We've had discounts through Fifth Third Bank. We do banking with Fifth Third as a company. We obviously clean Fifth Third Bank branches as well. So we have a nice partnership where if you indicate you're an employee of GRBS, there's a variety of discounts you can get through Fifth Third banking programs, from free checking, from discounted interest rates and discounted programs through a variety of loan options through the bank. We have discounts available through Sprint and Verizon as well for being a GRBS employee. You can sign up for those discounts and have that monthly discount on your bill just because you're a GRBS employee. And then we also partnered with Benefit Hub. So Benefit Hub is a company that allows discounts for a variety of different retail stores, rental car companies, hotels, restaurants, movie theaters. I know no one can go to a movie theater right now, but hopefully that'll change in the future. A variety of different locations and stores where, because you're a GRBS employee and you have access and a code to utilize Benefit Hub, you can have discounts that become available. I've talked to team members who've saved money, a lot of money on rental cars and hotels, as well as some retail stores. So I know it's a benefit, and I encourage everyone to sign up for Benefit Hub to make sure that you have access to those discounts. Should you decide you need to take a trip, next time you're heading out, take a look at Benefit Hub, see what options may be available to help save you some money. All right, so next up, what do you do from here? Every year when we do these refreshers, there's some standard things that we go through to finalize the refresher. As team members have maybe had some changes in their life, maybe the W-4 needs to be updated for taxes, direct deposit updates may need to happen, address changes, phone number changes, all these things may need to be updated with GRBS. Rather than utilize forms, we just got done talking about the portal, you can utilize the portal to go on and fill out those W-4s if you need to update your direct deposit form. You can change your phone numbers and email addresses as well through the Contact Us section. There's a variety of things that you can do through that portal to make sure that those items are updated. So again, big push for the employee portal on top of the communication, just the ease in which you can do updates for yourself so that you can make sure everything stays accurate as far as taxes, direct deposits, addresses, and phone numbers. Another piece that we typically will do during a normal refresher is get new badge photos for folks that need replacements on their for their badges. We talked about the importance of uniform earlier. The badge, I mentioned it, but it is a critical piece of the uniform. You have to be wearing your badge each and every day. It is a security piece. We have to let our customers know that we are who we say we are and that we belong in those buildings. And without the badge, that makes it so that it cannot be verified. So you have to have that badge. So if you don't have a badge, let your supervisor know so that we can connect with human resources and get you a new badge. If your badge is damaged, it's unreadable, we all have a tendency to dunk them in a toilet from time to time. We can get those new badges and get those replaced for you. Another piece of today, before you finalize and sign off from the video, there is a quiz that will be coming up towards the end here. Really important that you do that quiz. This refresher contained a lot of information on coronavirus, specifically towards the beginning, some other components as well that are required, that we want to make sure everybody had a chance to view, so that they have the information and they've gone through the appropriate training. So by completing the quiz ensures that you're getting credit for completing the video today. So make sure that you're staying on and completing that quiz. Lastly, I've said it a couple of times as we've gone through the presentation, but make sure you're reaching out. Since we're not in a position where we can go ahead and have a back and forth and ask questions, I want to make sure that everybody knows they can reach out to me. My email address there, bhall@grbsinc.com. You can also call the office as well, and I'll be happy to help provide any clarification on anything that was discussed today, any questions that you might have, anything that wasn't covered, reach out. Thank you, everybody. That concludes today's presentation. I'll wrap up similar to the way that I started. We've gone through a lot of challenges, a lot of changing, a lot of adapting through coronavirus. We'll continue to do so, but we will get through it. We will keep you updated as things change, from processes or policies, whatever it might be. I thank everyone for your continued hard work. We have an amazing opportunity to be able to stand out and shine for our customers. Remember, they're trying to start school in the midst of a pandemic, and they want to make sure that their staff is safe, their teachers are safe, their students are safe. And a lot of that is dependent upon us and the cleaning that is provided within those buildings. We have to make sure that we are doing a great job from the customer service standpoint as well as the cleaning, and that we're having a chance to shine for those customers and having a chance to make a big impact on the lives of people we serve and the communities in which we work in. So thank you, everybody, for spending the time listening today. I hope to see you all real soon, and have a great rest of the day and enjoy the year.